Hi, I'm Don Moores, and welcome to Montgomery Week in Review. While all of us will be busy shopping, admiring the beautiful decorations of the season at the stores we go to, we're nonetheless at the same time in great danger, or at least our credit cards, our whole history, or our whole future, financial future is in danger. Mariana Cordier, local attorney, will explain this and sound the alarm. The idea of separate days focus our spending has caught on. We got Black Friday, Cyber Tuesday, and the holiday season now. Giving Tuesday has joined these days for charitable contributions, an idea that's been around for a few years and just keeps expanding. Jessica Wilson from CCI Health and Wellness Services has this story. Outreach to the homeless is important in this country, and indeed in Montgomery County during the holiday season, actually every other day, but especially as the cold weather arrives. Jennifer Grinnell, who directs services to adults at EveryMind, has details about programs helping these individuals in greatest need in our community. Our last story focuses on some of the loveliest indoor plants, which we purchased to beautify our homes, I think about poinsettias during the holiday season. But you know what? These are also some of the most dangerous items you'll have in your house. Dr. Bruce Fowler, playing anchor, or being the anchor here, or the last cleanup hitter, I should say, has warnings for us and is sounding the alarm. Alarm number one.
Yes, alarm number one. I don't have any flowers, but and just bad news.
All right, so let's go through. We're in the store. We've got our charge cards.
Right.
We go in and
So,
we're vulnerable.
we hear about in the past, different compromised stores like Target was the big one, and others. Also banks,
Sure.
Wells Fargo and others. So what's happening is that there is a all-out free-for-all in hackers and folks that are in the ability to use computers.
So we've got the hackers out there trying to penetrate, and all these stores are trying to protect, and so it
Right.
really it's that.
So
what's
the
going on?
question, what you hear is someone will say to me, well, but I shop at Target all the time and it didn't affect me.
Right.
Because what really is going on is they're stealing the personal information, and the back of your credit cards, that strip contains a lot more information than what you think it does. It doesn't just have the credit card number and your name. It
Right.
has a whole slew of other
Sure.
things. And so what's happening is that is being sold on the underground.
But let's go through. You're going to the store,
Right.
and is it at that interface, or it's when it goes back into the system? Is that person? Are you afraid of the person who's swiping it? Are they going to steal it from you? Is the store going to steal it from you?
There are
What's
so
going on?
many multiple points of compromise.
So
It can be
use cash. No,
well,
I'm serious. I mean, is that,
there's a couple of things that you can do, which is I like to call it situation awareness. Okay, it's not about walking through the store knowing where everyone is. It's more of what we really hate to do. Review your bank statements, review your credit card statements. If anything doesn't look right, report it. If the bank or some credit card company calls you and wants to confirm purchases, call them back. Talk
Right.
to them, because they are also keeping an eye out for you. So a lot of the financial detriment isn't going to be necessarily to you. It's going to be to these institutions. But you need to be aware, because you never know if someone's going to empty out your bank accounts and all of a sudden you're left with a zero instead of your nest egg. And so
right.
So
those are the things.
is this something that we need to be aware of with stores like Target, for example? Now all of a sudden I'm scared to go to Target.
Well,
or
my
is it
advice
gonna
is
happen
always
everywhere?
right. My advice is, what? Don't use your debit cards. Use credit cards. There's more protection. There's less access or link to your bank account.
Right.
So that is the number on the internet. How much shopping is done on the internet? If you're in Starbucks using their Wi-Fi, that's fantastic, but it's free and it's not secure.
You shouldn't be doing secure. So if you want to be on Wi-Fi at a Starbucks or something like that, maybe check news feeds.
Well,
but don't go in and be doing.
Well, I mean, I have, when I am traveling or going around, I have a jetpack from Verizon that gives me internet, and it's secure, and it's only $10 a month. So for me, that's more important than having just free Wi-Fi wherever I'm going in an unsecure network that whatever's on my computer can be compromised. And for people who are using computers for work, it's not just your private information you're exposing your client's information.
What about, like, you know how you have a debit card, but if you are at, like, when you're at Target and you swipe it, but you have the option to use debit or credit, but
So
even though it says debit on the
The
card.
problem is that the information on that strip is going to have the debit information. It's not
Right.
going to differentiate. So my advice is I would really use the debit cards for emergency purposes.
Right.
There was a scam where people were they changed out after hours without the gas stations knowing
Right.
the thing that you slide in your
Yes.
credit card. And they were stealing your
Right.
information. So there's, you were asking where could it be the point of compromise? There's so many.
Yeah.
There's so
Okay,
many.
I want to back you up to where you started, because I've had a personal experience with checking the
Just a
bank
little bit
account.
over a minute left.
Okay, real fast. I started looking at my bank card statements. This was the bank's card. And I found a charge from an ice cream parlor. Now, I don't eat ice cream. And this ice cream parlor turned out to be in Hamilton, Bermuda. And I hadn't been in Hamilton, Bermuda in a long time.
So you figure there must be something.
There was something
amiss.
going on.
If you were
Something
there,
amiss.
you might have eaten ice cream.
Now, but what they were doing, they were charging $15, $20 a pop. It wasn't a big number that you would notice. It was a relatively small, but multiple times.
Right.
So I canceled the card.
And you do that with 1 million cards. That's 200 million. That's $20 million.
Well, one of those
Just
big
thing.
bank hacks was that they took from all the accounts that they could get access to $5, and nobody really caught it.
Yeah.
But they had taken millions of dollars because all the accounts were only just $5. It's just that there were so many accounts.
15 seconds left. Legal. What do you do if you see these things? Real
There's
quick.
not a lot you
have
can
no
do,
time.
so just be aware. Check your accounts, make sure you know what your balances are, and particularly where you have your money, notify the banks immediately, don't delay.
Or your credit card company.
Or your
and-
credit card company,
okay.
right.
Thank you so much.
Sure.
Alarm bells.
Right, so don't go on Cyber Friday, Black Friday.
Well, that does come in. Very
It is,
interesting.
yeah.
Just a welcome back. This
Thank
is,
you.
What a great organization you're with, CCI Health and Wellness. Your organization, like all the other nonprofits, and we'll be with EveryMind coming up next, not only in Montgomery County, but throughout this country. It really is a public-private partnership, but the private part is something that is a constant effort that you need to be attending to, right?
Yeah, absolutely. So after Black Friday and Cyber Monday, when we do all of our shopping and getting ready to give gifts for the holidays, there's a global day of giving called Giving Tuesday. And it's designed to bring together nonprofits and for-profit businesses throughout the world, really, to bring awareness to all the amazing work that nonprofits are doing, not only in your backyard, but also those partnerships that they have with other nonprofits in the area.
So hopefully after you've spent on all of these things for yourself or for others, buying goods and services, you develop a little bit of guilt
Exactly.
overnight.
Exactly.
And you can't sleep.
It comes on so
And
quickly.
then Tuesday morning,
You wake up and you're ready to give.
I need to give.
And so, there's an amazing website, givingtuesday.org, and it just tells you all about the great partnerships that are going on in your backyard and ways that you can get involved and just how they're giving back and doing good in the community.
And again, we can't, part of this show, we can't be talking about, hey, give us money and this, but tell us about what private donations do with organizations like yours. What does it enable you to do?
Absolutely. So it enables us to provide services to over 60,000 people in Montgomery County. We're really providing care to underserved and uninsured residents throughout Montgomery and Prince George's counties, and we're not really getting paid to do so. So private donations enable us to provide access to prenatal care for women that can't afford it, to provide pediatric care to families that have multiple children and can't afford to bring their kids in for those well child visits.
Sure.
It's donations like that. We partner with a great organization, the Greater DC Diaper Bank, and donations to them provide diapers to families that can't afford them.
Sure.
What about for the elderly?
So, we provide primary care to all ages, and so partnering with social service organizations
I think talking about the diapers as well, that because it's
Oh,
both the youngest and
absolutely.
the oldest in our
Yes.
family.
I didn't make that connection, but okay.
No, that's been
But
an
it-
issue. I think
But
that's
it's
been a
absolutely
big
true,
issue, sure.
and that's something that the Greater DC Diaper Bank does,
Sure.
and we partner with them because we do have patients that do need that, and we work with them, and we're able to provide those services to them through
No,
this.
and the reason I mention it is because with the elderly, that is such a growing population, and the talk of limiting benefits or cutting benefits, or they don't qualify for benefits, even if they have a little bit.
Of
It's
course.
really tough.
Absolutely, and that's why exactly what CCI Health and Wellness Services does is we provide access to primary care for those, not only access but affordable access.
Right.
We're going to provide care to anybody, regardless of their ability to pay.
What percentage of your population are immigrants? We have a lot of immigrants come into Montgomery County.
Absolutely. So I think about 45% of the patients that we see are immigrants and refugees, and we work with the state of Maryland to provide refugee health assessment screenings. So we're oftentimes those individuals' first point of contact when they come into the United States. We get them into prenatal care, we get them into pediatric care, we get their grandparents into primary care as well. And so it's incredible just seeing the diversity of individuals we're able to serve.
Yeah.
I know this may seem silly, but I think sometimes people don't give as much because they feel like even a small amount is not enough. But on the Giving Tuesday, it can be a small amount that's still helpful, I think, right?
Absolutely, and it's really just the act of giving back.
Yeah.
No donation or time spent or anything is too small. Really just bringing awareness to the amazing work that nonprofits like EveryMind and CCI do is half the battle.
Yeah.
A lot of individuals don't know that we're out there providing these great services, and we're an access, we're a resource for people in our community. And so just spreading the word and letting people know that we're out there and we're
Yeah.
able to provide these types of services is a huge
Not
deal.
just for the people who can donate, but for also the people who are watching who need the services and may not be
Absolutely.
aware.
I
Absolutely.
think following up on Bruce's point earlier about the immigrant community, I know that because of congressional actions, there are a number of benefits that immigrants are not allowed to apply for. And so I would imagine the private funds help to go to those to fill in the gaps, because health is something disease, illness spreads. Good health, it helps everybody.
Yeah, absolutely. Because when immigrants come into our country, there's a certain waiting period they have before they can apply.
Yeah.
And so it's super important for us to be there and provide that care at the point of contact.
We think it's super important to be there every day. So thank you very much.
Thank you.
Appreciate it. And we'll be right back after these messages. Welcome.
Thank you.
This is your first show.
It's my first show.
Oh my gosh, you're doing so well. Let's keep up that momentum.
I'm excited to be here.
EveryMind.
Yes.
I was fortunate enough to be at your gala.
Yeah.
Anniversary was fantastic.
It was a good-
Congratulations.
thank you,
What a
thank you.
wonderful evening.
Yeah.
One of the most important things that you all do is go after, is really try to address the most vulnerable in our community. And tell us about this program
Yeah.
with the homeless and the services and trying to really help those who need the help the most.
Yeah, absolutely. So we have a team of people. We're contracted by Montgomery County, and our main goal really, especially right now, every day of the year, like you had mentioned before, but right now, especially as we move into what they call hypothermia season,
Sure.
is we have a team of case managers who cover the whole county and really go out and are looking for our folks that are street homeless. So those that you might see living in tents in the woods, at our bus stops, at our metro stations. You probably go into some of the 24-hour McDonald's or other, fast foods that are open all night. Even our libraries are a big support where our homeless
Right.
individuals do go during the wintertime to stay warm and summertime to stay cool. So one of our main missions is aligned with the county, is their Housing First mission, and our goal really is to go and engage with some of these folks. And some of our, some of these clients have been living on the streets for 10, 15, 20 years.
And how do you? And what a tough adjustment
Yeah.
to come into about housing first. What?
Yeah.
You're coming at it from the mental health perspective. The needs are often center or start with that, but all these other services too. You're working with other organizations. Tell us a little bit about that integration or that wraparound nature.
It is. That's a perfect description, is the wraparound. So we work with multiple other organizations, lots of people at the county level. Really, the first step really is just engagement, right? Like just trying to get this person who's sleeping at the bus stop just to talk to you.
Trust.
Trust. It's a huge issue.
Not a lot of trust there.
No. And a lot of our clients have been let down in the past, have been told, I can do this, and maybe, who knows, for whatever reason, they didn't follow up. So it's our job now to keep going out. Even if they don't talk to us, we keep going out to try and get to know them. And with us, we bring different things every time. Snacks, water, tokens. Right now, we're bringing jackets, mittens, socks, all of these other kind of small amenities to try and get them to open up to us. And then we work with so many other providers in the county. It's not just EveryMind. There's multiple other providers to get somebody Social Security benefits, to get them, to start getting all the documentation to get them a house, right, to get them off the street.
Okay,
So.
what do you do with them when you find them? I mean, you're going to give them food and warm. Can you get them off the street?
That's a really great question. So right now all of the shelters have opened, right? So in the summertime, the shelters, close down, which kind of forces people to sleep outside. The shelters are open right now. So our number one goal, because you're right, if I met somebody the very first time on the streets, I can't get them a permanent house, but I can do a shelter referral to try and get them inside. So we would bring some of these other amenities, and then our goal would be to figure out where you're going to sleep tonight. And sometimes there is not a shelter bed available, and they do end up still sleeping outside again.
I asked that because I'm a professor at the University of Alaska Fairbanks, and in Anchorage and Fairbanks they have homeless people also. The local hotels take people in off the streets because you can freeze to death very easily in those places. And so one time I was there and it was 4 o'clock in the morning and I was jet lagged because of the time difference, and I went downstairs to see if I could find some food. There was this lobby in this really nice hotel full of people, street people, who were in off the street for that very reason, keep them from freezing to death. So the hotels, and I guess what I'm suggesting to you is you might think about asking.
About a minute left.
Yeah, so the county actually does have other resources. So the colder it gets, the more kind of
The alarm bells go off.
the alarm bells go off, and there definitely is funds from the county depending on, like, if somebody, and there are people who refuse actually, and then we do have to step in with some other measures sometimes to get them. And there is money for hotels sometimes. You're right.
Okay, well I think the hotels are volunteering to do this.
Yeah.
Okay. So if someone's a danger to themselves, I mean, this gets, and I mean, certainly folks who, paranoia, schizophrenia, all these things. 30 seconds left. What can you, I mean, I guess getting to the question, can you force people off? Is there?
No. I mean, we really can't force somebody off of the streets. Now, if I met them or our team met them and we really felt like they were in danger for their mental health, then yes, you could there are we could certainly call the police, and you can do other things to actually get them if they're a danger to themselves or others. But in terms of just sleeping outside, I can't make somebody come inside.
No matter how cold it gets.
No matter how cold it gets.
Keep up the good work.
Thanks.
May we get to a point where we don't have issues and people are safe and warm at night.
Absolutely.
Thank you so much.
Thanks.
All right, another alarm bell.
Ho, ho, ho.
Actually, these are all alarm bells. We've the alarm bell. If we don't provide funding for our nonprofits, what danger? But this is more physical in front of us. With beauty comes danger.
Yes.
Bruce Fowler, beautiful man.
Thank
Bring
you,
up
sir.
the danger. What's going on?
We're talking about poisonous plants, basically. This time of year, people like to decorate their homes with things like poinsettias and mistletoe and other colorful seasonal plants, or bring in the ones from outside. What many people don't realize is that a number of these plants actually can be quite toxic if you eat them.
Right.
The population that we're most concerned about, the two populations, are young children, small children who would go and graze on the house plants. And
They do. That's not funny. But I'm just trying to think of a kid
It's the
going
crayon,
around.
the plant, the crayon.
Right. grabbing some leaves and maybe putting them in their mouth to test.
or
That's
berries,
what kids do.
bright berries.
Oh, the berries.
Yeah.
The berries, but sometimes it's the berries. And mistletoe, that's the case. But also pets. Dogs and cats
Right.
will chew on plants as well.
Right.
And then they can get a trip. An
What's the
emergency.
most poisonous of what we are typically seeing in?
That you bring in or that you have in your house.
Yeah.
Well, it's not a Christmas plant, actually. It's a tobacco plant.
Okay.
Okay. Tobacco contains nicotine, as you know, and nicotine is a toxic substance, a really good one, bad one.
Right.
And people, if you have a smoker in your home, they're sharing the experience with everybody who lives there.
Sure.
Okay. So that means that children who might have asthma or some kind of respiratory disease will be exposed to that stuff.
So you're doing the indoor smoking.
Indoor air
okay.
pollution.
But in terms of plants that you have, what are we talking about? In terms of poinsettia, let's say somebody eats. You find that a child chews on a poinsettia leaf.
Yeah.
What danger are we talking about?
Well, initially it's going to be gastrointestinal. They may vomit. They may develop GI symptoms. Thing to do is call the Poison Control Center, and the number, I think, is appearing on the screen. Other things, though, that's usually for poinsettias, not usually lethal.
Okay.
Now, the mistletoe is another matter. Those little white berries that are on the mistletoe are actually quite poisonous, and they can kill you. So that's a more immediate thing. Other plants, though, that you wouldn't think of, like philodendrons,
Right.
for example, or Dieffenbachia, which is this nice, it's a very beautiful plant, has nice long yellow and green leaves.
Okay.
Those are full of what are called oxalic acids, which will form calcium oxalate. It'll precipitate in your kidneys and plug them up. That's the bottom line.
Which is not good, right?
No, you don't want to go to the emergency room for dialysis if you can avoid it.
Wow.
Okay, so that's one kind. The other one, though, is foxglove or plants that are involved with, digitoxin.
Okay.
Okay, and that can stop the heart or
The heart,
cause it to race, and people can get into cardiac difficulties with that. And then,
We got less than 2
Okay,
minutes here.
I'll
Let's get some questions here.
You know how when you've got the poinsettia in your house and then eventually the leaves kind of dry up and they fall off, are they still as toxic for that part that's fallen off?
I don't know that,
Okay.
actually. I mean, usually these plants kind of ramp up when they're starting to bloom.
Like they're blooming,
You know,
yeah.
they just brought them in.
Yeah.
Interesting. I'm, as a cat owner and cat lover, I'm curious about these plants and how you would know, and you may not know the answer to this, if your cat decides to have a nibble on several of these deadly poisonous plants.
They're sneaky, aren't they?
They are.
Yeah, do it in the middle of the night. You don't know, but what usually will happen with the pets is that they will start moping around. They won't be eating properly. They will be lethargic. They'll be sleeping more than they should. Their behavior changes. And then that's the time to take them in to see the vet.
We got one more
So it's
question for Dr.
probably-
Fowler.
So basically, you don't have any of these plants in your house. The moral of the story is,
Well, I
Choose
can,
another red plant.
choose something non-poisonous, right?
I can tell you what I have in my house.
Yes.
I have silk poinsettias made coming from Home Depot. You don't have to water them.
Mine aren't as fancy as yours, but I have plastic poinsettias. And that's because I
Same
have a
idea.
habit of killing all the plants. But so I'm toxic to them. But it sounds to me that if you have small children or animals, it's better off not to have
It's better to prevent it. Yeah.
Better prevent it. And we now prevent the mistletoe too, huh? Is this the reason
Well,
why
you
we
can
should
hold
have
it all you
mistletoe
want,
anymore?
just don't eat the berries.
Break the berries, but still it's something we can, it's for the real purpose of mistletoe to snuggle up with folks. Is that still okay?
I
or-
think that's just fine, but then you have to think about what are you going to do when
Michael
you're done
sells
with
the
it.
fake ones.
Yeah.
Well, one thing is that we're not fake here. We're real. I want to thank all of you for joining me today. I want to
Thank
thank all of
Thank
you in the
you.
viewing audience for joining us for this week's edition of Montgomery Week in Review. I'm Don Moores, inviting you to join us next week at this very same time.